Serving all of San Diego, this is your Fox 5 News.
Just a few hours ago, the European Union's health commissioner urged Europeans to avoid traveling to the U.S. and Mexico. Also this morning, Germany's largest holiday tour operator says it is suspending all flights to Mexico City. In Mexico, the number of suspected swine flu deaths has now topped 100. And we have 4 cases right here in San Diego County. Joining us now is an ER doctor from Alvarado Hospital, Reza Tirgari. Good morning, Dr. Tirgari.
Good morning.
First of all, what is swine flu and how do you know if you have it?
Swine flu is an infection that's basically been endemic in pigs for many years. Once in a blue moon, a human being will be infected from being in close contact with a pig.
So it's viral like the regular flu?
It's exactly like the regular influenza virus that we all know and love and we deal with every year at this time during flu season. This is a genetic variant. And sometimes when pigs come into close contacts with humans, such as at swine fairs, humans can get infected with this virus.
Such as what? Swine what?
The swine flu virus
No, but what did you say when humans and pigs come in close contact, such as what?
Such as at fairs and trade shows, for example. We have one documented case where a woman got infected from being at a county swine fair, and she actually developed a variant that other people at the fair also were infected with, but only developed mild symptoms.
So does this thing spread, this swine flu, does it spread like your normal common cold / developing into the flu?
Exactly the same as other flus. And so the same precautions would hold true as with the regular flu.
Yeah.
And so regular close contact, sneezing, coughing, touching of surfaces where someone has sneezed or touched who's been infected with the virus.
Okay, but you just told me exactly what the symptoms are for regular flu. So how do I know if I have the swine flu?
You don't. The way that you would find out is if you go and they diagnose you with the flu at a hospital or a doctor's office, and they would do a swab. If the flu was discovered to be positive on the swab, they would send the sample to the local health authorities, and they would actually do the testing for the swine flu virus.
Right now we're looking at some of the symptoms of the swine flu. You can go ahead and just read that off for us.
Of course. You have fever, coughing, sore throat, achiness. In some cases you have the chills, and you can develop nausea. If you're tired or weak or lethargic, those are very common flu-like symptoms that people develop.
And normally when you get any of those symptoms, you sort of run to your local drugstore, you take a couple of concoctions, and you go to sleep overnight, you wake up, you're okay. So now should we start going to the doctor if we get the flu?
Generally, there are some people who are more at risk. People over the age of 65, people who have other medical problems such as diabetes, children under the age of 7. We tend to tell people in these subgroups to be a little bit more vigilant about their symptoms.
Yeah.
And there's some people on medications such as steroids that can depress your immune system, and they can make it more likely that you'll develop a more severe infection.
Because the regular flu shot's not going to ward this thing off.
Absolutely not. The regular flu shot, and this is very important for people to know, will not protect against swine flu.
But is there a flu shot for the swine flu?
Not to date. They're working on potentially developing a vaccine if it warrants it. Statistically speaking, swine flu hasn't reached the point where people really need to be concerned enough. I think,
but it's getting there.
It could be. We have to remain vigilant because history shows that many pandemics started the same way.
Yeah. We have to run. We shouldn't, yes or no, should we be concerned about eating pork as long as we're not eating it raw, correct?
No. Anytime you cook your food, you have so far, 0 risk of developing swine flu.
All right, so basically we got to watch out for those fairs and interacting with the pigs. No, I'm serious, right?
Generally, yes. The bigger concern is making sure that if you're sick, you avoid close contact with other people. Stay home from work. If your condition is serious enough, you want to seek medical attention immediately.
Dr. Reza Tirgari, thank you very much
Thank
for
you so
swinging
much.
by the Fox 5 Morning News.